Right. And Dr. Kim, what about fatigue?
Fatigue, chronic fatigue. As I said, for diabetic people, muscles don't get enough nutrition. So muscles are actually lack of nutrition. So they feel constantly fatigued.
Right. So this is going to be people really dragging
And
themselves out of bed in the morning.
They lose muscles or muscle mass because they don't get nutrition. Also, as I said, because of this frequent urination and thirst, they tend to wake up during the night a few times.
Right. So they're not sleeping well.
Also, whole body aches.
Right.
The quality of sleep is gone. So they wake up very tired next morning, and then they live a very tired day, another day. So, and then keep on having a poor sleep next day. So this thing continues. So
really,
it's fatigue.
really
yeah,
impacts quality of
that's
life
correct,
in a huge
that's correct.
way.
And then good news is the P700, invariably, without exception, people say they just recovered their energies in their life.
So their energy levels dramatically improve as a result of using P700.
Yeah. So if we know how P700 works, that's a very natural conclusion.
So it makes sense from what you've described.
Yes.
Yeah. And so what's the correlation between diabetes and weight loss, or weight gain, I should say?
Do you remember the visual cycle we just mentioned just a moment ago? Because of that, once you have diabetes, it's almost impossible to control weight.
You've got everything against you.
Yeah. And then if you are obese, it is almost impossible to control diabetes. So I'm quite frustrated when people say when you have diabetes, you should control your weight. It's just
how do you do it?
How do you do it? You're just repeating the question. It's not suggesting a solution.
Right.
So for diabetes people, there are inherent reasons why they find it so difficult to control their weight. So there should be something else except in addition to saying you should control diet. It's just repeating the question.
But what's the impact of P700 on controlling weight?
Actually, when the former president of American Diabetes Association, when he reviewed the studies of this P700, he recommended that, Dr. Kim, you should develop this product as a weight control product rather than diabetes product. Jokingly, he said the market for weight control product is 10 times larger than a diabetes product. But we decided not to because, in order to compete in weight control market, you have to control with all those outrageous claims, something as 10 pounds in 1 week. L-leotin works very slowly.
And L-leotin is the other name for P700.
Sorry. The P700 in different countries is being called differently.
Right. What's behind the name P700, incidentally?
They repeated and constantly modified the formula through 700 or more experiments.
Okay, so that makes sense with the name, right?
So in China, P700 is called Happy Pancreas.
Pancreas.
Yeah, Happy Pancreas. And then
to the point, Happy Pancreas.
And then in Korea, it's called Formula M.
Different names, different type of marketing, I would guess.
They say M stands for mysterious formula. But in North America, some people call it
Right, right, and that's the name I've heard. And so, Dr. Kim, you're talking about people taking this formula when they're not diabetic. You're talking about taking it generally. What about children? Is it safe for children to take?
Correct. That's the point I'd really like to emphasize. As far as I know, P700 is the only product which is safe for children. We tested this P700 with 50 times of the dosage, still safe. So, and then as I kept on saying, these are classified as food in Southeast Asian countries.
Are the regulations more stringent for food than for drugs?
That's correct. That's correct. And then, therefore, safety is proven there. So, from the viewpoint of parent, any treatment for diabetes of their children, safety should be the first concern.
Right,
and
absolutely.
Then, and then that's the point I really like to emphasize here, safety.
Sure. Yeah, so Dr. Kim, are you talking about a medical discovery here? Because it sure sounds like that.
It depends on what the medical discovery is. Medical discovery as opposed to dietary discovery, medical discovery as opposed to lifestyle discovery. I just don't know what to call, but I'm just telling you, here's the product. 50,000 people used it. They got tremendously happier. Scientists tested this.
Right.
So I just don't know what to call. But
so whatever you call it, it's having an impact.
Impact, yes, that's correct.
And so I grabbed some of these bottles here. I mean, these look like, they look a lot like prescription drugs. I'm curious about the 3 different formulas. Can you tell us a little bit about why it comes in 3 different formulas like
this? This formula is a morning formula. Morning formula helps the body to regulate the speed of the breakdown of carbohydrate. Therefore, usually diabetic patients experience a sudden peak of blood glucose levels immediately after their meals.
Right.
But with a morning formula, that peak is flat.
Smooth it all out.
So morning formula has that function.
Right.
And this afternoon formula, basically cleanses. So afternoon formula cleanses the old insulin receptors.
Right.
Insulin receptor is what regulates how efficiently body uses this insulin, right?
So it's making it all more efficient.
Young.
Yeah. We all want to hear about that. We all want to hear it's going to make us young.
Yeah. So old senile insulin receptors are washed out, cleansed out of the body, and then in those places, young, stronger, functioning insulin receptors come out.
Right.
So, and then a night formula. Night formula basically provides necessary nutrients for pancreas, and then with this supply of good nutrients to pancreas, beta cells rejuvenates.
Right. So you're creating a happy pancreas.
That's correct.
Right. And Dr. Kim, what about fatigue?